I was interested in knowing what kinds of things affect service demand. So what were the factors that would make a difference in services experiencing increases in calls? And at that time, I thought, oh, I think there's some research out there about disasters and how that changes things. So I called up Deb and Claire. I knew they were doing work in this and said, well, you know, what's out there? And was surprised to discover that there was no evidence or research that sort of documented in Australia that there was an increase in violence after disasters. And I thought, well, certainly this is a known thing. This must be a given, right? So then I looked into the international research and found that the question is quite a bit more complex than that, and there isn't a lot of research out there. So then I set out to find everything I possibly could that looked at this issue and try to synthesize that. And so I'm going to kind of walk you through that. It's going to be pretty brief. It covers a wide range of areas, and I'll only go into a few small details and examples. I would encourage you at lunch or at the break or in my role of the Clearinghouse to call me and chat with me about any of the questions you might have we don't get to today. So I'll just dive right in to the big question. Does intimate partner violence increase after a disaster? And let me also be really clear that I focused entirely only on intimate partner violence and also only in industrialized countries. While the research that comes from all over the world has important relevance and we can learn a lot from it, I was particularly interested in anything that would be relevant specifically in the Australian context. And also, as we've heard today, interestingly, this issue is often not at all acknowledged or addressed in industrialized countries. So that was why I really wanted to know what was out there. And that only came up with about 20 or 30 published articles or reports. There's quite a bit out there in other anecdotal ways, but this is going to cover just what's been published. So to answer this first question about whether or not violence increases after a disaster, there's sort of two main sources of data. The first one comes from victim interviews and surveys. So this is kind of your research that's trying to look at prevalence or incidence or trying to say that there's a change in the percentage of people who are reporting violence. The results are really conflicting, as you can see from the slide. So their increases range from 5% to 98%, and decreases from 33 to 50%, 57%. So huge differences. And it's only 5 studies, and I should say most of those come out of the US. 4 of these did. 1 came from China, and most of the research really is only coming out of the US right now. The thing that explains those differing and conflicting results has to do a lot with the measurement challenges. So, for example, those 5 studies, all of them were cross-sectional. So they only asked women at one point in time about their experiences. So one study after Hurricane Katrina asked women, as much as 2 years after the event, tell me about your experiences 6 months before, 6 months after, your entire lifetime, and then the 2 years after as well. And interestingly as well, those studies also adapted validated measures to measure things. So every single study altered the questions to meet their own agenda or what they thought would fit for their population. And in all of those studies, they used 3 questions or less to capture any change or experience in violence. Additionally, they measured completely different things. So some studies looked only at sexual violence and physical violence. Some only looked at psychological and physical. Some lumped it into one category. Some differentiated it out. So it really varied. And all of those things sort of contribute to the differences in the results that we're seeing. Additionally, the populations that they asked were quite different and complex. So 2 of the studies only talked to women who were in temporary government-funded housing. The other 3 only talked to women who were still residing in their own communities, in their own homes. Which is interesting because you're thinking, well, what about all those other women? And to think about just what that means, after Hurricane Katrina, 1.2 million people were evacuated. In some of those hardest hit communities, less than 95% of the population, only 5% of the population ever even returned. So where are all these other women, and where are their stories? And most likely, the women who are experiencing violence are not going to be in government-funded housing and not living in their original home. So we're not even measuring their own experiences. So the next source of data comes from organizations. So this is the kind of stuff that Lois is talking about. And these sources of data tend to be a bit more consistent in their conclusions. Now, there's only 9 studies that are published, but Elaine's got a great handout in your packet, so look at that later, that goes over 2 pages that talks about all the other anecdotal evidence that comes beyond those published stories. So we know there's so much more than that out there, but because it doesn't get written about, often policy planners don't ever see it, and the debate continues. All of those studies, all 9, unquestionably found huge increases in service demand. So this is agencies finding clients who are coming to them and seeking help. So just some quick examples. Police protection orders, the increases range from 15 to 65%. For DV organizations, most of this comes out of New Zealand from Rosalind Houghton's research. It ranges from 40% to 300%. And allied agencies also, so these are agencies like health workers, victim support, your government welfare agencies, non-government agencies that provide education programs, are also seeing doubling and tripling of their workloads. An interesting thing in these studies is that most of them, oh, I just lost my page. Most of these studies, they are able to do before and after comparisons of data. So we're not catching that in the other studies that are asking women about their experiences. They actually can track that change. And these studies have gone, some of them, not very many, have gone as far out as 2 years and have documented sustained significant demands 2 years out. Now, whether or not that demand goes beyond 2 years, we have no idea because no one's actually reported beyond 2 years. So it's possible the demand is even further than that. So the next question, though, is what are we actually measuring? Are we looking at experiences or are we looking at service demand? And then when you really start looking at that, well, what exactly are we talking about with experiences? We've heard quite a different views of stories and personal experiences of what is happening. So are we talking about people who are experiencing violence for the first time? Are we talking about people who've been experiencing violence for an extended period of time and are only seeking help for the first time? And this might happen because their normal sources of support that help them cope and manage with what's happening are now just been decimated and they have nowhere else to go. It could also be that they're no longer willing to tolerate what they were before with everything else that's happened. Or just the disaster has changed their perspective on what they're seeking. And I think about, Pauline shared a story last night from Queensland about a woman whose house was destroyed. And they were looking at getting funding to rebuild that house. And she said, I don't want to go back to that house. I don't want to go back to that life, to that lack of safety. So it's affecting these women as well. And then the other question, of course, is what about all of the clients, all seeking help at the same time? And I think the thing you can sort of take away from this is that the experiences of violence are very diverse and very complex. And it's very hard to sort of nail it down to a number or a stat that says it's only this experience, and this is the sole reason we're seeing a change in the demand for the services. But the other thing that's so interesting about this is that in all of this research, only 2 studies have ever actually asked women what they think. So a lot of these studies have tried to sort of hypothesize or guess what they're seeing happening. So because women, statistically, this many reported it before and this many reported it after must mean that's new or there's no change. Very few people have actually asked women how they define their own experience. And Deb and Claire's research was some of the first to do that. And then there's been one study out of the US, and they talked with 15 women, and the women split directly into 3 categories. So much like Deb's, they've done quite this division. So in that case, 5 of the women identified that the violence was new, regardless of whether or not their partner was new, that they'd never experienced it before. 5 of them identified that the violence had escalated and changed. And 5 said that either the violence that they were experiencing before decreased or was the same as what they'd always experienced. So I think it really raises this issue that we should be talking to women about their experiences. But another one of the really big questions that's often debated is what is the cause? If we're seeing this increase, why is this happening? And as policy planners, we really want to know what this is because then we think that that can help us plan our interventions in advance if we know what's happening. And often we'll hear this theory about the idea that it's this experience of increased stress and trauma that leads to violence. Now, there actually have been 3 studies that have tried to test out this theory. One of those studies did find among women that there was some relationship between the severity of the impact of the disaster and a few tactics on the conflict tactics scale. Although they asked women who had given birth 6 months after Katrina and were still living in the area and were postpartum. So possibly not the most generalizable population to ask about their experience of perpetrating violence at the time. The other two studies one's looked at men and women, and the other one's looked just at women. And both of them found absolutely no connection between a person reporting PTSD, so post-traumatic stress disorder, anxiety, depression, hostility, or the severity of the disaster, and their subsequent perpetration of violence. They were absolutely experiencing all of those things, and they were definitely related to the disaster, but they weren't related in the way that they were contributing to their actual violence. So the studies kind of call into question whether or not that theory is really true. And other theorists have sort of thrown out this idea that is it actually about an escalation in controlling behaviors? And so a way to think about this is a case study that was done with a woman who, in floods in the US in 1997, initially talked about the fact that she had not experienced violence from her partner before, and that over a 2-year period he became more violent to the point where she became fearful for her own life and for her children's, and she left the relationship. Now, the researchers spent over those 2 years quite a bit of time talking to this woman again and again about her story. And over time, this woman began to sort of describe her experiences before the disaster with her partner, and described behaviors that we would define as violence, that were controlling and threatening, that he was abusive of their finances, he was emotionally abusive, he was demeaning and put her down, that he sort of dominated over the home, but he never used physical violence. And she sort of, over time, reflected on the fact that his pattern of behaviors had always been there. It just changed and became more severe after the disaster. So there is that question about, is this violence, sort of, are the patterns already there and they're just escalating into more severe violence? And again, very few people have actually asked women about this, and instead have often tried to hypothesize from the research. So an example of this was an article published out of the US again after Hurricane Katrina. They saw a decrease in calls to the police, but an increase in subsequent arrests, and they attributed to that to an increase in severity of violence. Now, that's quite a huge leap in sort of why arrests are happening. There could be so many other factors there. So unless we're actually asking women about what's happening, it's quite hard to really discern that. But I think, so from all of those studies I've just talked about, those are all mostly around stats and numbers and trying to quantify what's happening. And I think what's important to take away from that is that it's so much more complex than that. And we need to really look at the experiences of what's happening for victims and organizations. So I'll talk just briefly about sort of the increased vulnerability for victims, and then I'll also talk about this vulnerability for organizations and sort of how they experience the disaster. So with this slide, I've put up sort of all the range of areas where victims might experience sort of negative impacts from the disaster. Now, you can put the slide up and say, well, this is true for anybody after a disaster, and it is. But what the research highlights is that women who are at risk of violence or experiencing violence are experiencing worse impacts on their situation in comparison. And just 2 examples of this, you've heard quite a bit today, but financial impact is massive when you think about the fact that many of these women accessing relief funds often is tied to their partner. So if their partner is violent, they're unable to leave that situation because they can't get any financial support other than through their partner. And other stories have indicated that partners who have left, where they've separated because of violence, those partners have returned to seek those relief funds and are abusing that situation to try and get that money back. So that's an issue that is unique to women who are experiencing this violence. And I think the other thing that really is quite significant is that all of these studies found that women who were experiencing violence and disasters had far higher rates of mental health symptoms and PTSD and symptoms of trauma than either women who had only experienced the disaster or only experienced violence, which implies that there is this huge compounding effect, an intertwining dynamic of experiencing the disaster and violence. So these women are at a huge vulnerability and in great need of services. Now, the other thing I kind of want to mention is that, and it's often not talked about, but a few studies have captured also this is a time of resiliency and opportunity for some of these women. And there's just been a few anecdotal stories about some women have seen this as an opportunity to leave and either when they were relocated or displaced, that moved them away from their partner and gave them a chance to start their life over again. Or maybe they were able to access relief funds that did give them a chance to start. One woman talked about experiencing 7 years of violence before the disaster hit, and afterwards, because she survived the disaster, she realized that she actually was capable of surviving and leaving her partner as well. And she developed this sense of confidence and skills that she would cope. And she was able to successfully leave that relationship. And interestingly, in the disaster, it was the first time she'd ever contacted any services or sought any help as well. So what about organizations? They're also going to be hugely impacted, as you're hearing as well today. And these are many of the areas that they'll hit on. I want to talk about a case study that Elaine kind of mentioned earlier. I'm going to go into it in more detail because I think it's quite interesting. So this is the refuge out of New Orleans that was decimated by the disaster. They lost their building. They lost all their computer systems. Some of their staff never returned. And interestingly as well, the government withdrew their core funding because they weren't able to document that they had clients, because they didn't have a computer system and paperwork to prove they had numbers. And this agency, I think that their story is quite amazing because they hit the ground and they went door to door and started handing out flyers and leaflets. They went to disaster relief centers and health centers. They went to faith groups and started handing out brochures and sort of re-saying, hey, we're providing this service. Because of course their clients couldn't find them and they couldn't find their clients. And eventually this agency, through really strong interagency relationships and partnerships, and also just this creative passion, was able to gain a new source of central government funding and set up a whole new model of service delivery. They restructured their mission and their whole hierarchy of working, and they've set up a one-stop family justice center through this new path of funding. So they're a great example of sort of the devastation that happens to organizations, but also the internal resources and assets that those organizations have. They're also coping and recovering in this time of disaster. So what about preparedness and planning? Not very many studies have actually looked at this, and I'm going to talk just about domestic violence organizations themselves. Really only Elaine's research from the late 90s and probably Rosalind Houghton's research from New Zealand, she's published a few articles, have really sort of looked at organizations and how well they're prepared. And what they're finding is that they're not adequately prepared, particularly for a catastrophic event. And they may be even excluded from general planning processes. But at the same time, these people are aware that this is an issue. Just as Lois was talking about after Rosalind's research, they know this is out there and it's a possibility. They're interested in taking action, but they need funding, they need support and training and expertise from people in the field. And they themselves also have resources and skills to offer. And I think one of the things you really take away from some of the research when you're looking at how organizations are impacted and responding is how absolutely essential interagency relationships that were good before the disaster benefit them after. And there's two great examples out of Rosalind's research in New Zealand. There was an agency that wasn't included in any of the disaster planning before the disaster. And after the disaster hit, so the government local community welfare group got together, and they didn't include the local refuges. When they asked to be there, they turned them away. And the only reason they got there was because the police actually advocated for them to be there. So it was that previous long-standing relationship where the police knew that they were essential and had to be at the table that got them to the table. Another community had quite the opposite relationship. So this agency found that after a snowstorm, they felt that none of the other service providers were aware of the issue of violence and weren't contacting them, asking them about their needs and whether or not their agency was met. But they themselves also did not report talking to those other agencies and talking about their organizational needs. So there was a real sort of disconnect even in their own organizational communication around those partnerships. So from all of that, there's a lot that we don't know, and these are some of the things that have just come from that. We don't know about the impacts on the recovery long term. Some of these studies are indicating, as I said before, that the impact is lasting well up to 2 years and is far more devastating than we ever could have imagined. But no one's asked past 2 years. And not only that, no one is really talking particularly to these women about how they actually recover or how they cope with the situation. We're so caught up in trying to document that there's an increase that we're sort of missing this whole other picture of what happens. I think the other thing that's really quite disappointing to find in the research is that not a single one of those studies looked at culturally and linguistically diverse populations, indigenous communities, lesbian gay communities, older women, or disabled women. There might have been a reference to them that that population might be at increased risk, or that there were some concerns, or that maybe they thought they had an increase in clients from that community, but no one actually has ever asked any of those populations about their experiences. And the other thing I think is so interesting is that there are gazillions of recommendations and guidelines and toolkits that have been coming in the last few years across the board, but no one has actually asked the emergency sector about their perspectives. Deb and Claire were really the first researchers to try and sort of capture some sense of attitude or perception among workers, but we've done very little research that sort of says, we're sort of saying the emergency management sector needs to get involved, they should be engaging with our organizations, they should be looking out for these women, they should be serving them and meeting their needs, but no one has asked them if they're aware of these issues, what they think about it, what their understanding of violence is, what they think would be appropriate, how they would respond. So it's just a huge loss. And I would also say, the more we have these conversations, the more I think we realize what we don't know. And I would add 2 more dot points onto this just from sitting here today. We don't know a lot about men. I think only 2 studies have ever talked to men from the perspective of perpetration or victimization. Like, no one's really talking to men at all, and we're not even studying them. So we've got all these theories about what's happening, but sort of we're missing this other half of the equation. And the other thing that's really interesting is this complete lack of documentation about what works. Very few people are writing down what they're actually doing, and we know it's obviously happening, because there's definitely documentation that all these service providers are seeing an increase in demand, and they're meeting that demand, and they're offering more services, but no one's been talking about the things that they've done that have effectively worked, or how they've planned and that's actually benefited them. And I think that is absolutely essential as we keep driving forward. And I guess sort of 2 kind of points to leave you with that you take away from all of this research. For me, I wonder why we are still debating if there's an increase in violence. The first study published that documented this was in 1980. And at that point in time, over a year, they documented a 45% increase in police reports of domestic violence. It was 30 years ago, and we've continued to document it since. Why are we still debating about this issue? Why do we think that we need to worry about whether or not it's there? It's obviously there. We should be responding. And I think the other thing was sort of this great study that was done again in the late 90s that looked at 3 different communities and found that the 2 communities that did respond had agencies that were already working on violence and already had an awareness among their community. And the other community that didn't respond didn't really perceive that there was ever an issue in general around domestic violence. And at the end of the day, if we don't perceive domestic violence as an unmet need after a disaster, we will not respond to it. And it should be considered a basic human right that we should be able to live safely and free of violence. And it has to rank in that level of our planning. So I'll leave you with those 2 thoughts.